What causes an Achilles tendon to tear? I'm talking about the tendon that connects to the back of your heel right here, and it goes up into your calf muscle. This tendon can tear at times if you have been very active. It usually happens in athletes, very commonly in basketball players. It's possible to see signs of an Achilles tear way before, months or even years before the actual tear happens, and the tear is usually sudden. It comes on when you least expect it, but those signs are there. And I'm talking about like calf pain, tenderness on the Achilles tendon itself, and stiffness, especially when you get up if you've been sitting for a while. That happens super commonly, but I'm talking about some other signs that are less looked at, especially in the medical field. Before I go into those other signs, let me just give you a little bit of some basic anatomy, because then the signs will make a lot more sense when I talk about them and why you can spot them now. So if we're looking at the foot here and the lower leg, I'm going to draw some muscles around this anatomy model so you can understand this. So if you're looking from the top view down, here's the back of the heel. That's where the Achilles tendon attaches, and it goes up about that much. Then the Achilles tendon turns into the big calf muscle. There's the gastroc and the soleus that make up that muscle. But just deep to that, right up against the bones of the back of the lower leg muscles, you have some muscles right in there. There's three key ones that I'm most concerned about when it comes to Achilles problems, especially Achilles ruptures. And the muscles are called the posterior tibialis, which attaches to the arch of the foot right here. And then you have another one that's called the flexor hallucis longus, and then the flexor digitorum longus. Those are toe flexor muscles. They make your toes flex by bending them right here. If you have good strength in those toe flexor muscles, what happens is, because all those tendons, they run through the bottom of the foot and they run under the arch of the foot. Posterior tibialis attaches to the bottom arch of the foot, and then they go up the inner part of the ankle, right on the inside part of the heel, and up behind the Achilles tendon and the calf. Because they run in that same direction, they can help with pushing the foot down. We call this plantar flexion. When you push your toe down, or like you're stepping on a gas pedal, it's the same motion that the big gastroc, the big calf muscle that makes up the Achilles tendon, it's the same motion. However, they're toe flexors, so they help to curl your toes and they help to hold up your arch. Here's the thing though, I don't have clear percentages, but this is what I tell my patients. When you're going to step up, or if you're going to tippy toe, if you're going to do this kind of a motion right here, it's not all coming from your calf muscle. I tell people it's about 80-20. I don't have clear numbers. I'm just giving them an idea for what to expect. But most of it's going to come, most of the force is going to come from that Achilles tendon that attaches right here, pulling your heel bone up. But you also have some force being generated from your toe flexors and the posterior tibialis helping you go up right there. But if you don't have good strength in your toe flexors, then you're not going to have that 20% support when you're pushing your foot down to tippy toe, or to jump or run or walk even. So as a result, you end up putting too much force through that Achilles tendon right here if you don't have strength in the purple muscle, and over time that causes problems in the tendon itself. It can cause a tenderness, it can cause a calf pain, it can cause a stiffness, and then you hit a certain threshold where that thing breaks. And because the tendon itself doesn't have a whole lot of feeling in it, you can't always, of course you feel tenderness and all that, but you get used to it after a while. You don't know when it's going to happen. You just have symptoms that come on. But here's what I look at whenever I'm looking at somebody who is at risk for an Achilles tendon rupture, a tear. They're going to have things like bunions. That's where this big toe starts to come inwards here. It can also happen in the little toe. That one will come inwards right there. They may also get hammer toes, and that's when these toes in the middle start to bend upwards like that. Those are all signs that you have weak toe flexors. Because if you maintain good toe strength, which isn't something people usually think about, and I'll tell you how to do that, by the way. There's exercises that you can do, and they're not what you think. If you can maintain good toe strength, then you're going to continue to allow your gastrocnemius, your big calf muscles that make up the Achilles tendon as they go down, you're going to allow the normal forces to go through that Achilles tendon by supporting it with the other toe flexor muscles. This is an imbalance that develops on the back side of the lower leg and into the ankle. You have to have good toe flexor strength in order to put normal forces through your Achilles tendon so that you don't overload the Achilles tendon and gradually break it down over time, walking into a situation where you may get tear. Now there's some other factors here. We're going to talk about shoes and mobility. Let me go into mobility first. A lot of people think that in order to help an Achilles tendon, a stiff, tight, painful Achilles tendon that's on its way to tearing, that you need to stretch your ankle like this. You need to go stand on a step and stretch it out. And I think the reason for this is most people think that it feels good. You kind of need to move in that direction because your foot wants to rest down in this direction because that Achilles tendon is being pulled on by the big calf muscles that are overdoing their job because your toe flexors are weak. And so it just makes sense to do that stretch. But it's such a short-sighted treatment. It's not fixing the root problem. You're not getting stronger toe flexors. It's only giving you some temporary mobility. And then as soon as you get back into your regular movement without your toe flexors, you're back to putting yourself in this position. And then the thought is that you don't have good mobility at this ankle joint. And I agree, but let's dive into this a little bit. It's going to get some technical just a bit, but I want you to follow me. If you think about the leg bones, there's the lower leg bone, and then here's the foot bones. Just going to draw them all together. And you have the Achilles tendon pulling this way, right? That's where the tendon is, and it goes into the muscle up there. Then you have these toe flexor muscles on the posterior tibialis that go down this way, and they send their tendons past the ankle, and some of them go all the way to the tips of the toes. So their line of force is this way. So you have an upward force and a backward force. And if we zoom in at the ankle here, let me just make it bigger. If you think of the big ankle bone right there, and I'm just going to simplify the way the joints look. So this is the foot right here. I'm just going to draw an F, and then this is the lower leg. So we're zooming in right here. If you have a force from the purple muscle pushing this way, and then you have the Achilles tendon pulling this way, if your Achilles muscles are way stronger, it's going to put your foot in this position. When you do that, look at what happens to that ankle bone, the bottom half of the joint. It opens it this way and it kind of pulls it forward, pushes it in that forward direction. It causes a joint alignment problem. When your ankle right here is chronically resting with the bottom half of it forward a little bit, it messes with the mobility. All of a sudden you can't bring your foot up as good. This is why some people have trouble squatting. When they do squats, they can't go as low and they'll blame their ankle mobility. It's because they don't have good toe flexors. If they can get better toe flexors, then this problem is resolved. Because if you go get better toe flexors and you have this backwards pull from the toe flexors on the ankle joint, it shifts the ankle joint into the right position so that the joint is most congruent. It fits on itself as best as possible. Instead of being shoved forward like this, it sits into where it's supposed to be, allowing for maximum mobility based on the way the bones are designed. So getting those toe flexors stronger just shoves this bottom part backwards to where it needs to go so that you can get better mobility moving your foot upwards. This toe flexor problem is huge. It's an epidemic. Basketball players all over the world probably aren't strengthening their toes enough, and so they're using their big calf muscles, the gastrocnemius and the soleus, the ones that make up the Achilles tendon, and they're overusing those tendons. Runners are falling into any running sport. Football, soccer, distance running, sprinting, any sort of jumping sports, they're all likely weak in the toes for the activity that they're doing. And if they had stronger toes in conjunction with the normal calf strength they have, they could better tolerate their entire season without rupturing an Achilles tendon or running into problems at the very least, just getting sore in the Achilles tendon, having to slow down, having to deal with the stiffness, and potentially setting yourself up for problems down the road. So how do we fix this problem? Obviously, you got to strengthen your toe flexors. And here's the thing, most people, when they think about strengthening their toes, they think about picking up marbles and pens with their toes, pretending you have monkey feet, but that's not how our feet are designed. Our feet are not designed to grab things. They're not like hands. The toes are a lot shorter for a reason. They're designed to give you stability. So what needs to happen initially is you need to be able to curl your toes through the full range of motion. And just like in your hand, you have knuckles that pop out right here in the sole of your foot. You have knuckles right there. They're these big knuckles. When you curl your toes, you should make sure that you bend at those joints. A lot of people just bend the tips of their toes and not the joint that's closer into the sole of the foot, the medius part of the foot. Being able to do that, oftentimes people will start cramping in their foot muscles. They can't do it. You just first have to start with that. You have to work your way into getting stronger there so you're no longer cramping and you can begin to get conscious control over the entire mobility of your toes. Once you can do that, now you've got to start to think about using those toe flexors in your everyday motions. So like with walking. So when you stand and you put weight on your foot, your toes should subtly grab down the ground. And the direction that I like to give, the description, is if you think about your fingernails, because your toes have nails in them, your toenails, when you put pressure through your fingernail, it blanches. It turns a little white. You don't have to put a ton of pressure for it to start to blanch. That's just because the blood's leaving the area, and so it's no longer pink, it's turning white. And if you were to look at your toes, as long as you don't have any paint on them and you can see your toes and all that, when you grab the ground subtly with your toes, you should see your toenails blanch a little bit, or even the skin on the tip of your toes, just like with your fingers, they'll blanch. So another way of saying this is if you can just put like 10, 20% of pressure through your toes when you're standing, that is how you activate your toe flexors to then begin to do activity. So every time you take a step as you're walking, your toes should grab the ground, grab the ground, grab the ground. And that's what you should be consistently doing. And you have to train yourself to do this because you may not reflexively do this. Shoes kind of restrict you from doing this very often. So you may need to practice this barefoot. Now, I'm not saying you should be barefoot all the time. I think being barefoot at times is great, but you're not going to play basketball barefoot, all the time, especially competitively, maybe here and there. You may not run barefoot. Some people do, but if you're going to go sprinting, you probably want to have on some spikes to get the advantage. If you train yourself to use your toes normally when you're just walking around and in fitness and exercise within your shoes, then it'll carry over into competitive situations because you're in the habit of using your toes and you've trained your muscles and tendons so that they work well together, the forces are distributed properly, and you're not overloading your poor Achilles tendon. This needs to carry over into jumping as well. If you're playing basketball, if you're doing any sort of jumping sports, you need to think about when you squat down to do a jump, grab with your toes and explode up, and your toes should be leaving the ground at the end. It's going to happen in an instant, and you may not be able to do it perfectly, but if you train like this 80% of the time, then you're setting yourself up to not do it perfectly in the middle of the game. You're going to reduce the likelihood that you're going to tear your Achilles tendon or run into pain, run into problems that begin to move you in that direction. Now, what about shoes? A lot of people look at toe drop shoes. In other words, where the heel's a little bit higher than the toes, so your toes are dropped. And the idea is to put your heel in a slightly higher position than your toes so that it's shortening your Achilles tendon and not putting as much strain. I think it's a very, very short-term solution to do that because you're not doing anything about the toe strength, and it may help you temporarily, but it's not fixing the root problem. It's kind of like putting a Band-Aid on a leaky pipe. You're just going to have a very short-term fix to this problem. It's not going to allow you to play an entire season just by spending an extra $100 on some fancy shoes that are designed to keep your heel in a certain position. Same thing with insoles or orthotics. They can help, It might alleviate the pain, and I'm not against it. I tell people to use them, in fact, to get certain shoes and to get certain orthotics, but I have to educate them on that's not solving the root problem. It's like a crutch. You're just using it temporarily for a short time, but there's still other things you need to be working on in order to fix the whole problem. So let me bring it all together for you. When you have Achilles tendon problems, you need to think about strengthening your toes, not stretching your Achilles, not trying to gain more mobility. That stuff's okay to do. It's okay to stretch, but it's not fixing the root problem. If I ever saw you stretching, I wouldn't tell you to stop. I'd just say, hope you're strengthening your toes as well. You need to first be able to bend the big knuckles in your toes. Then you need to be able to do that while you need to be able to activate your toes while you're standing, then do it while you're walking, then do it while you're jogging, then do it while you're lifting weights, then do it while you're running and jumping and doing more aggressive, intense activities. It needs to be the habit that you use your toes all the time. If you can do that, then you'll be protecting yourself against an Achilles tendon or an Achilles rupture, and more importantly, protecting yourself from the long year of recovery that comes after having a surgery if you go down that route. If you want to see how to use your toes during walking, like I was mentioning, check out this video, because I know a lot of you guys have knee pain. This one's called "This Toe Trick Will Improve Your Knee Pain," but it's going to help you out with your Achilles pain too.